For children who suffer migraine headaches, the pain is very real and very intense. But according to Essentia Health pediatric neurologist Dr. DeCock, there's good news for the majority of kids because the power to conquer frequent headaches is in their own hands.
In our adolescent population, there are just some bad choices they make.
Bad choices that Dr. DeCock admits he and a lot of adults make too, including not drinking enough water, eating poorly, too much screen time, and not enough sleep. On top of that, Dr. DeCock says children and teens are under more pressure than ever these days.
The stakes are much higher for some reason. There's a lot more pressure on people. They're staying up later, they're working harder, there's more stress, there's more anxiety. Anytime you have stress, anxiety, depression, all of that's going to make things worse.
All of these things can trigger the intense, throbbing pain associated with migraines. But Dr. DeCock says there is hope. First, see your doctor to assess what's going on with your child. They may suggest small dietary changes that can help, or medication like ibuprofen or Benadryl. But Dr. DeCock says medicine alone can't solve this.
Here's all these choices we make or situations we find ourselves in, right? Dehydration, anxiety, depression, what we're eating, that sort of stuff. And then here's medicine trying to work. Well, the problem is if you don't get rid of this, your medicines aren't going to be that effective anyway. And so lifestyle modification really should be the first line for headache treatment.
Dr. DeCock says some headache sufferers can do everything right and still have migraines. But he says for most of us, including children, taking a close look at our everyday choices could provide some solutions and much needed relief. With this Essentia Health Medical Insight, I'm Tracy Briggs.